consultant neurosurgeon at Yashoda Medicity, and I'm looking after the division of minimal invasive brain and spine and endovascular neurosurgery. Common headaches that we see are not associated with any underlying related disease, but there are certain features of the headache, like persistent headache over the period of time, progressively increasing in intensity, not responding to over-the-counter analgesic drugs, plus associated with kind of a morning kind of an headache on bending forward, and plus associated with other symptoms like blurring of vision, problem in the balance, or an hearing problem kind of a thing, then you should think of there's some underlying cause, probably a tumor associated with it, and need to seek medical help. Well, most of the times we go for over-the-counter analgesic drugs, at least in the initial episodes of headaches. But what it does is it delays the diagnosis, it lets the underlying disease progress over a period of time, and ultimately when patient lands with the clinician or with the surgeon, it becomes risky for the patient and for the surgeon as well, making our task difficult. So it's better when you have some red flag signs associated with the headaches to consult your doctor immediately so that they can help you better. In fact, quite often, most of the times, the initial episodes of headaches, it starts with a very low, mild intensity, especially with the young adults. They ignore it, thinking it to be related to stress or some other kind of trivial causes. And that actually leads to the delay in the diagnosis. One thing we need to know, the brain doesn't have pain receptors. So anything that develops inside the brain won't give you much kind of a pain. But what happens is as the tumor grows, it stretches the covering of the brain, which is actually pain sensitive. And when the tumor grows to a bigger size, it stretches them, and then the pain increases. And by the time patient develops that excruciating sort of a pain and comes to us, tumor is already big. As I mentioned earlier, all these headaches associated with the red flag signs, like associated hearing loss, any neurological deficit, any weakness, or any personality changes, and these things you should be very much vigilant enough to know when the symptoms are starting, and when they do, you need to seek medical help immediately. In this regard, your family members can actually help you out. They are the best ones to actually judge any subtle differences in the personality changes, any loss of memory, any increased excessive irritability in your behavior. These can be noticed pretty much early by your near and dear ones who can actually help you out and pointing out that you've got some problem and you need some medical help.